And welcome back to our midday newscast. Right now you're watching a news conference happening in San Francisco with Mayor London Breed. Let's listen in.
Coronavirus. We are on day 3 of the shelter-in-place order, and we have this operations center here fully operational with a number of city departments who are working together to make sure that we are prepared and coordinating in our hospitals, that we are working to prepare with our homeless and vulnerable populations, that we are working to provide information and safeguards and other things in a very timely manner to residents of the city, that we are communicating with businesses that are basically ordered to shut under the direction that we provided but have not done so. We want to make sure that we don't take for granted that everyone has the information, so we want to get out there, be proactive, and communicate to a number of businesses and people that we see out in the community what the order entails, to provide clarity on that order, and just to, just communicate to the public that we understand that this is, of course, quite challenging for so many people. But this is not a vacation. This is not time for social gatherings. We want to discourage the gathering of large groups as much as possible. Shelter in place, of course, means that you and your family members and the people who are part of your household are the only members in that household. So we are discouraging play dates and dinner parties and other things that typically you would maybe want to do in your homes, but this is really about slowing down the spread of coronavirus, and it's about making sure that we at least have available to you some of the essential needs that so many people might have. So that's why the grocery stores, the pharmacies, the cannabis clubs, the gas station, the banks, and places that are working on this particular issue, like our hospitals, our fire stations, and our police stations, the essential city services and resources are available. But we want people to shelter in place, to stay at home if at all possible in every single instance. That is how this is going to work. So we do understand that this will be quite difficult. We are on day 3, and there is still uncertainty. This is an evolving situation, and as information is provided to us, we make a decision as to what is in the best interest of the people of this city. We are up to 70 confirmed cases of coronavirus now, and as you can see, it continues to rise, and we want to make sure that we are prepared. We want to make sure that we definitely flatten the curve. And you hear this talk about flattening the curve. That is real. The goal is to prevent anyone from getting infected with the coronavirus. That's what this is all about. We don't want to inundate our hospital system. We don't want to create challenges with people who may not be able to self-quarantine. We are here to ensure that the city is ready and prepared to deal with any challenge that comes our way. And we can't do it without your help, without your cooperation, without your support and your understanding, and definitely your patience. So at this time, I want to introduce the Director of the Department of Emergency Management, Mary Ellen Carroll, who will give you an overview of this Emergency Operations Center that has many dedicated city employees who have really stepped up to provide a level of support to respond to the coronavirus crisis that's here in San Francisco. Mary Ellen.
Thank you, Mayor Breed, and thank you for being here today. I want to thank the mayor for her steadfast leadership during this pandemic. Her foresight in taking early action and unwavering support of our emergency managers, our healthcare professionals, and our disaster service workers, many of whom are here in this building today. Protecting the health and safety of San Francisco is and has been our most important responsibility. The novel coronavirus situation is changing rapidly, and San Francisco needs to continue to be aggressive so that we can flatten that curve and disrupt the spread of the disease and protect community health. To reiterate, all San Franciscans can do their part to help protect the most vulnerable residents by staying at home, practicing good hygiene, and checking on people by phone who might be isolated. We are grateful to everyone out there who are following the orders and taking these measures. But there are many of us here within the city that have to go to work so that essential city services can continue. And this includes first responders, healthcare workers, and emergency managers. These people are on the front lines of the COVID-19 response, and they are dedicated to the health, safety, and well-being of our residents. And we are many here in this building today. So we have been preparing since January when we elevated our Emergency Operations Center to focus on preparing San Francisco for the novel coronavirus. And much of our early work was on establishing situational awareness and educating the community on the virus. On February 25th, in coordination with the Mayor's declaration of emergency, we surged our Emergency Operations Center with emergency managers and disaster service workers from across the city and city departments to accelerate our advanced planning and operations. We are now at our highest level possible. We have dedicated so many San Francisco government employees to this effort that we have had to relocate here to Moscone Convention Center South. This is where we have the space to work, but also in this unique situation, we need to have social distancing even when we are here together working. Here, we're working with all of our partners to fight this pandemic, and we continue to support essential city services that need to remain open. So what are we doing here? This includes supporting essential city personnel, ensuring city services have the resources that they need to maintain regular cleaning, and helping agencies outside of the city and in the city that provide essential services to continue. This EOC, Emergency Operations Center, will continue to support the efforts to shelter and care for people impacted by COVID-19 and vulnerable populations. We will keep the work being done here going every day until we get to the end of this pandemic. Many in the EOC have been working many straight days and nights and have sacrificed day-to-day comforts like spending time with their loved ones. But we are all in this together, and I can personally say I have not heard one city employee complain once over the last 6 weeks about their deployment or the work they're doing, and I'm so proud of them. So while we are here, we just want to remind everyone, while we're here managing COVID-19 on the inside from the center, we want everyone to remember that you have a role to play in the city's response. We need you to stay home and only leave for essentials. We need you to heed the order and listen to the mayor's message and the things that she said just here today, this morning. To our older adults, it is even more important that you stay home so you are not exposed. And for those of us that are not in the vulnerable populations, we need to be looking out for our partners, our family and our community members who are more vulnerable. By staying home, we truly can save lives. So finally, we want everyone to stay up to date on this rapidly evolving topic, and we encourage folks to text COVID-19 SF to 888-777, and you will receive important updates about the COVID-19 situation. In addition, you can go to sfgov.org for real-time information. Many of the people in this building are working around the clock and are updating that website on the hour. So if you have questions, you need information, you want to share resources that we have, there's so much information there, and I encourage those who can to go to that website. And finally, for those that are unable to access the website, 311 operators are waiting. They're ready to answer your call and answer questions and point you in the direction for resources that you may need. So thank you very much for being here today.
I'll just go and get that straight.
Good morning. I'm Dr. Grant Colfax, Director of Health. I would like to thank Mayor Breed for her leadership in aggressively preparing for this epidemic. San Francisco is in the vanguard of taking action early and continuously to respond to this rapidly resolving situation. I also want to thank Director Marion Carroll for her partnership in leading the emergency response, and all the city departments who are coming together to work together to do everything we can to support San Franciscans. And most of all, I want to thank the members of the San Francisco community who are my public health heroes and doing everything they can. Thank you all for coming here today and supporting San Francisco's efforts to slow down the spread of the coronavirus and save lives. In concert with other Bay Area counties, we are continuing to move aggressively to slow the spread. And it is true that every hour counts. We need everyone to take action to protect our community and particularly our most vulnerable populations. The regional order to shelter in place is brand new for our community, and the Bay Area is the first place in the country to take such an aggressive approach. I know that San Franciscans want to do the right thing, and we are already seeing big differences in people's behavior as they adjust to these new rules and these new times. I'm so thankful, we are so thankful for everyone's participation and care for one another. To review, all San Franciscans must stay home as much as possible and only leave for essential activities like getting food and medicine. Even then, they and you should stay at least 6 feet away from others. It is okay to go outside to walk your dog, go for a walk, run or hike, alone or with someone else from your household. You can also go outside with someone else, as long as you stay 6 feet apart. We know that people need exercise and fresh air, and there's a way to do that within the confines of this order. But for people who are over the age of 60 and those with chronic health conditions, or especially those who are currently sick, please stay home altogether. We know that staying at home is disruptive. It has to be. The virus thrives under normal conditions. We encourage people to learn more about the order by referring to the frequently asked questions, as Director Carroll mentioned, at sf.gov. We are preparing our health system and our city functions for a potential surge in coronavirus patients. And we hope that it will be diminished by our aggressive efforts to slow the spread of the virus. Put it simply, we need as much time as possible to be as prepared as possible. I would especially like to thank the frontline workers who continue to care for our community members even during this health emergency, including and especially in healthcare settings, and our first responders who are engaging with people at risk for this virus on the streets and other places every day. To ensure that hospitals and healthcare facilities will have as much capacity as possible in the case when the surge of coronavirus occurs, the health officer has issued an order effective yesterday prohibiting routine procedures and elective surgeries. These things can wait, and they must wait. Now, we are decompressing the healthcare system as much as possible. I remind everyone, please do not go to the emergency room or an urgent care center unless you have a true life-threatening emergency. Contact your healthcare provider by phone. Use telemedicine. Get the information anywhere else that you can. Please do not go to the healthcare emergency room or urgent care. Those places desperately need to be saved for the people who are truly ill and need them most. The mayor has also used the power of the local emergency declaration she made on February 25th to order a streamlining of the hiring process for nurses in our public health system. We are bringing on scores of new nurses in as soon as 10 days. And I was just talking with our HR people, and they told me this morning that we already have 70 new nurses hired, and we expect scores more this weekend and soon and in the near future. We are having a job fair this weekend to hire nurses on the spot. Today, we have 70 confirmed cases of COVID-19 coronavirus in San Francisco, and that number is rising and will continue to rise. We know that the virus is here in our community, and yet we still must fight aggressively to interrupt it by drastically reducing the chances it has to jump from person to person. This remains a rapidly evolving situation, and as we have learned more, we have followed data, science, and facts, and our interventions have escalated. I greatly appreciate the way that San Francisco is pulling together to follow the new rules and to help prepare and protect our most vulnerable populations, our healthcare workers, and our health system. Everyone can and must do our part. And I must say, I'm so impressed by our Emergency Operations Center. It is a hive with the bees 6 feet apart. It is a hive of well-organized activity with multiple city organizations coming together in pursuit of one shared goal: to protect our community and to slow the spread of the coronavirus. It takes every sector: health, law enforcement, law, infrastructure, social services, transportation, and services for those experiencing homelessness. I am inspired to see this incredible city, its essential workers, and the services step up and take on this challenge we are facing together. Thank you.
Thank you, Dr. Colfax. And I just wanted to take this opportunity to introduce the Director of the Department of Human Resources, Trent Rohr, who is working on the plan to support many of our vulnerable populations who live in congregate settings, so that we are prepared, if necessary, to not only provide shelter in place access for those particular populations, but an overall plan. Many people have asked about the challenges with our homeless population. We have not forgotten that, and we are continuing to work on that issue, and so I want Trent to provide us with an update.
Thank you, Mayor Breed. I'm Trent Rohr. I'm the city's Director of the Human Services Agency. And we're the agency tasked with providing care and shelter in this pandemic for our vulnerable populations. You know, thanks to the mayor's leadership and the leadership and guidance from Dr. Colfax, we activated our department's command center last Monday, so 11 days ago, to prepare for this. Using the best data that the Department of Public Health had at the time, we were charged with identifying 3,500 hotel rooms to be able to use for isolation for individuals whose current housing situation does not allow them to quarantine on their own. So who is this? This is the 19,000 or so individuals who live in a single-room occupancy hotel room where there are community bathrooms and community kitchens, and impossible for those persons to isolate alone. And then, of course, it's our homeless population, both who are residing in our homeless shelters as well as homeless who are on the street. We quickly responded to that and have been working to secure those rooms. We did secure our first lease yesterday and moved the first people in this morning. Those first people were homeless individuals who were tested in the hospital, but are not showing signs that need them to be hospitalized, and so we moved them from the hospitals to that particular hotel. This will be a very common occurrence. We don't want people who do not need to be hospitalized to be there simply because they can't isolate. This is why we're bringing the hotels online. We have identified probably we're at about 500 now, a little over 500 that we hope to have secured through lease and online, staffed with the appropriate personnel by the end of the week or this weekend. We think that is enough to manage the current projected surge. Also, thank you to the mayor for speaking with the Hotel Council membership yesterday morning. And because of her leadership, as well as Dr. Colfax and the Chancellor of UCSF as well, and myself, the Hotel Council and the large hotels in San Francisco have been very responsive. We have among those hotels well over 2,000 rooms of hotels who have expressed interest. The next phase will be our health and human services teams assessing the suitability of those hotels for the population that needs to be quarantined. The second group of individuals that we want to provide housing for, or hotel rooms, are of course our first responders. We don't want our healthcare workers who are on the front lines to go home, potentially infect others, be infected in their communities and not be able to work. So we are standing up hotels for them as well. And those hotels from the Hotel Council will be suitable for them as well. And those rooms would actually be in addition to the 3,500 we have for those who need to be quarantined. And then the last housing shelter effort is, of course, the vulnerable population who are on our streets, as well as populations in our existing shelter system. Per the CDC and State Department of Health's guidance, as well as our local Department of Public Health, we need to create social distancing within our homeless shelters. We have about 2,000 single adults in our shelter systems and Navigation Center right now. We are going to be reducing capacity in our existing system and moving them to shelters that we will pop up in locations throughout San Francisco. In addition, we will be deploying our outreach teams on the street to identify vulnerable populations, whether it's age or underlying health conditions or both, to move into those congregate environments as well. Those shelters that we pop up will be staffed by the appropriate personnel who will be able to quickly identify people who are showing symptoms to be able to remove them and move towards isolation. We are currently, I guess fortunately that we're in the shelter place stay-at-home mode. There are a lot of large facilities that will be available to us. So we are assessing those sites now, figuring out how to lay them out per the health standards, securing staffing, as well as, of course, food provision and other services. We envision standing up probably about 2,500 rooms. This would be about, 2,500 spaces in shelter. 1,500 of them will be to people who are currently in shelter and will just be moved, and then another 1,000 for the vulnerable populations we identify on the street. Our system that we've developed is nimble enough to be able to expand should that need arise. My direction to them has been find as many large spaces as possible. Do not limit yourselves to capacity of 2,500 because we may need more. I'll be happy to address questions at the end of this. Thanks.
Thank you, Trent. And the Board of Supervisors has been really an incredible partner in this effort. And in particular, there are members of the Board of Supervisors that are here with us today, including Supervisor Aaron Peskin, as well as Supervisor Asha Safai. And at this time, I want to ask Supervisor Peskin to say a few words.
Thank you, Mayor Breed. As the mayor just said, we are here on a full-time presence, the Board of Supervisors. We are all united. We are very disciplined. We are extremely focused, and we are working very well together. I am very proud of the leadership and employees of the City and County of San Francisco, and together we're going to flatten this curve.
Thank you, Supervisor Peskin. And I just also wanted to ask Police Chief Bill Scott to provide an update on what happened in the city yesterday. I know that we have put this order into place, and the folks that have been really on the front lines in terms of helping to implement the shelter-in-place order has been the San Francisco Police Department, and I wanted Chief Scott to provide an update.
Thank you, Mayor Breed. As of yesterday, the San Francisco Police Department continued our efforts to help prevent the spread of the COVID-19 virus. And as we've stated before, our primary mission is to have compassion, common sense, and voluntary compliance. And if all else fails, we do have a legal order where we can enforce. I'm happy to say at this point we have not had to enforce, and I know that there have been sporadic sightings of people holding hands and that type of thing in the city, but I want to make it clear that we are doing everything that we can to message to people, to educate the people that we come in contact with, to practice social distancing as laid out in the health order. This is a tremendous disruption to everybody's lives, and we get that and we understand that, and so the education is key. We started doing bar checks the minute the order went into effect, and that was midnight on the 17th of March, Monday night, Tuesday morning. Our officers assigned to patrol under the leadership of Assistant Chief Michael Redmond and Deputy Chief Greg McEachern were tasked with going to the bars and restaurants in their respective districts to ensure that we had compliance with this order. And we were very pleased that even prior to midnight, most of the restaurants and bars had already began to shut down. So we did not have to enforce. We've seen an overall tremendous response from the people in San Francisco, and we appreciate that. As far as our workforce, as was stated, our first responders and our police officers, we started early on because of the leadership of our mayor and our public health director. We tried to get out in front of this starting in January. We started aggressive messaging on the basics, washing hands, making sure that our officers did everything possible not to spread this virus, and we believe that that was key in not impacting our workforce. At this point, we have not had any major impacts on our workforce. We're telecommuting where at all possible. We've canceled all training. Our officers that are assigned to administrative functions are in uniform. Right now, most of those officers, or many of those officers, are working the streets to supplement patrol. Our academy staff right now is working the Civic Center, UN Plaza area, and the downtown area, walking footbeats. We want the public to not have to worry about public safety. There's enough things to worry about. We don't want the public to worry about crime. So we're not saying that crime will not exist, but we're going to do everything we can to not make that be the worry. Our officers will be out there in numbers. Many of you have seen them, the police cars with the lights on, officers working footbeats, and that will continue. We don't know how long this is going to last, but we want to do our part to make sure that we do everything that we can as police officers to prevent the spread of this virus. And again, I can't emphasize enough how important the leadership standing behind me, starting with the mayor, was on allowing us to get in front of this. And that's been key, I think, in getting the compliance that we've gotten this far. So thank you, Mayor. Thank you, Mary Ellen Carroll. Thank you, Dr. Colfax, Supervisor Peskin, and the city leadership and all the department heads. Thank you.
Thank you, Chief. And just before I open it up to questions, I just want to take this opportunity because I really thought that we were already past the xenophobia that has existed since the beginning of learning of the coronavirus and its origin. You know, it is very unfortunate that this continues to be an issue, and it is offensive not only to our Chinese community here in San Francisco, it's offensive to our city as a whole, where we pride ourselves on our diversity. We know that this disease is not discriminating against someone based on race. We know that people who are being diagnosed are of all races and backgrounds. And so the longer we perpetuate this divisiveness, this racism, the words that continue to allow for the focus to be on that particular issue, the less we are able to deal with this together. This is a time not for divisiveness. It's a time for us to come together and to support the residents of our city and not make people feel excluded. So sadly, this continues to be a problem where the president continues to stand by his messaging around his labeling of the coronavirus, and we want to make it clear that that is not something that's acceptable or tolerated here in San Francisco. So I want to thank you all again for being here today, and we know that as this situation continues to evolve, we will do everything we can to update you and provide you with the most accurate information. And again, making a decision to shelter in place is not one that was taken lightly. It was taken at the direction of some of the most incredible public health experts anywhere in the world. And we will get through this if we comply, if we, in some cases, you know, sacrifice clearly to get, you know, to a better place. None of us wants to be in this situation right now, but we will get over it if we continue to work together and comply with the order and do our part. So thank you to all the folks in our city who have done a tremendous job in helping us to keep the streets clear and do what you can to support your households and your neighbors. Thank you to the leadership of the city and the dedicated city employees who show up not only here at the Emergency Operations Center, but the people who are showing up to our police stations, our fire stations, our hospitals, the dedicated folks who are going to help get us through this crisis. So with that, I'm happy to open it up to any questions.